Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. If you've watched this program before, then you know that each week I have a different guest on the program where we talk about different services, programs, or healthcare issues that I think will be of interest to you and your family. So I hope you'll stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Jill Cohn. She's a physical therapist assistant here at KRMC, specializing in aquatic therapy, right? Did I get that right?
That's right.
Awesome. Now, before we talk about all that, I want to help our viewers get to know you a little bit better and where you come from, because from that water being your passion. Yes. So you were sharing with me before the program that you've kind of, since you were almost born, since you're little, like the water.
Yes, I have.
So how did that happen? Where were you born and how did you get into the water?
I was born in Boulder City, Nevada.
Okay.
And
so just out our back door?
Not far at all. I love this area. I always have. And when I was young, my mother was my swim instructor. She did not pass me originally. However, after my second class, I was a fish from then on. And so I've always really had a passion for the aquatics department.
So you came by it almost genetically. If your mother was a swimming instructor too?
She was, and she always enjoyed the water. So
very good. Well, that always helps.
Yes.
Helps get rid of that fear of the water from the beginning. And that's, I
does.
think, a big thing that stops people from enjoying the water.
It does.
Yeah, and here when we live in the desert, water is pretty important inside and out.
Oh, absolutely. That's a good point.
Right. Okay, so now how did you transition that enjoyment of water to the passion you have for aquatic therapy?
Yes. I had, before college, worked as a lifeguard and a swim instructor. And then I kind of kept that that notch in my belt. I worked here at the Wellness Center beginning in 2002 and had gotten back into that field after college and realized that therapy was really an important place for people, recovering, maintaining their conditioning, and then the aquatics department was helpful because that environment allows people to achieve some of the activities that they have trouble achieving on land at home. And it's a nice bridge between regular activities at home and keeping your strength. So.
Awesome. Now, you had shared again before the show, we were talking about how water is so buoyant that, or helps you be buoyant. I don't know if I'm saying that right.
It does. So the buoyancy of the water, you're absolutely right, Jamie.
Okay.
The buoyancy of the water helps to assist the patient, and it unweights us. So it's supportive, and it unweights the person, so it takes the stress off of your body. For instance, if there's a person that has ankle, knee, or hip pain, even spine, when you're at about your navel, you're approximately 50% your body weight, which is so helpful for the body to go through activities and not hurt maybe as much.
Right.
And then the percentage changes, but when you're at shoulder depth, you're about 10% your body weight. That's not very much, so it's really a nice number.
So that would almost be like exercising on the moon.
Almost. And the water's so comfortable and fun.
It is, especially if it's, well, I know our therapy pool is at nice temperature, so it's not like jumping into the cold lake. I think that would be a little different.
Sure.
Therapy probably wouldn't be quite so much fun if you had to do that.
It is more forgiving in the warmth, yes, that's true.
So you got your education initially in therapy, or did you go back and specialize?
I did go back
okay.
and specialize. I initially had an animal science degree.
Oh, you did? You were going to be a vet?
I did. I worked as a veterinary technician
Oh,
and
very good.
worked in that field for 15 years. Then I ended up bridging, working at the veterinarian and starting over here just to get my feet back into the water in 2002, and I decided I really love what I see with the therapists coming in with their patients to the water. People that have difficulty standing and walking could do it. And so I ended up pursuing another degree, and it's a community college degree, Mojave Community College down in Havasu has the PTA program. So
very good.
yes, that's where I finished my.
Well, that's nice for people to know that they don't have to go far from home, and they can still have that career choice. That's awesome.
Right. That's right.
And we do have the water, the river, and plus, of course, we're blessed here at KRMC to have our wellness center and our awesome pool there. So
true, but a lot of people do utilize the bodies of water nearby. They do.
So the therapy, the kind of exercises and things that you help people with, so they come to you with, well, you mentioned earlier, they could have ankle, knee, hip, spine even.
Yes.
So they can do exercises in the water to help strengthen those muscles.
They sure can.
What kind of exercises do you have them do?
Well, we'll do similar exercises to what you'll see people doing in the gym setting or at home in their home gyms, or maybe even just walking is easier in the water. We have a lot of patients too with other limitations or problems, such as stroke patients and just patients that have maybe had neurological issues. That stroke falls into that category.
So even like balance?
Balance,
is
definitely balance. So we have orthopedic and the balance.
Okay. And I know I've seen you work in the big pool with people too, as well as the smaller therapy pool. So what are you doing different in the big pool than you're doing in the smaller pool?
I really love your questions. I think they're very helpful because there is an answer to all of that, and a lot of patients and even members aren't sure what we're doing different. But the therapy pool is a 3 to 4 foot pool in depth.
So it's shallow.
It's more shallow, and that's helpful for people to get used to weight bearing again if they have trouble standing in the store or at home in the kitchen. But that pool, the therapy pool, is 95 degrees roughly. And the membership pool, the wellness center pool, is roughly 84.5, 85 degrees. And that's not really that chilly. It depends on the patient. It depends on blood thinners. There's a lot of variables.
Sure, I didn't think about that,
It
but that would be
depends,
true.
Sure, on our own body and even the weather outside around us.
Yes, definitely.
The
And
environment.
it's always that fun shock when you come from the pool, when you've gotten used to the water,
Yes.
and then you come into the shower room and you're like, oh.
You know, you're a swimmer.
I am,
you
but
are.
it's the condensation difference is really, it's not that it wasn't cold when I went from the locker room to the pool. It hasn't changed. It's just
It's interesting how we adjust to things. And so there is a trick. If people would take a cooler shower, or once they shower before they get into the pool, cool down the water a little, and it's a little bit easier to adapt.
Transition.
That's a trick.
Yeah, I'll have to remember that.
Yep, and a lot of people wear something that is a similar material to what I have on, and like a nylon, and that's a good cover-up, which helps give you a thermal layer.
Right.
And the big therapy pool is 85, I'm sorry, I already said the temperature. It's about 4, 5, 6 feet in depth. It's a longer pool, so some of my taller patients, I feel it's more appropriate to have them in that pool.
That makes
Also,
sense too.
if it's appropriate orthopedic-wise, it's nice to get some traction in the deep end. So that's another way to
actually go further.
Yep.
Yeah.
Unweight the spine, and there's a lot of good core exercises to build our postural muscles. So so many benefits.
That's. I know I've done your therapy myself personally. Helped with my knee and my ankle, and then that's how I kind of got into going. Oh well, this is hard on land, but I can do it in the water. Yeah.
And it's a good way to cross-train. And because the buoyancy works some of the muscles that we don't always work, that's opposite with gravity. So I really like that little benefit. It's a subtle one, but it's another way to work out.
But you know, I have to tell you that because when you're in the water and you're so buoyant and you don't feel, so you kind of are like, am I really using my muscles? Am I really exercising? It doesn't feel like that.
Good point.
So are we?
We are, and it's interesting that you have to work a little different. I love when there's a lot of activity in the pool, and I tell a lot of our patients, you're working harder right now because of the added turbulence and the added activity around you. You have to work, and sometimes we can work through our own turbulence, walking in a certain direction, and then as we come backwards, we have to walk through our own turbulence. And so we do work harder, it's just different, and certainly it doesn't feel that we are.
Right.
Many patients will feel sore maybe 2 days later. I think it depends on our conditioning level.
Sure.
So,
Just like with any, even on land,
sure.
depending on how good a shape you are and what, if you haven't used those muscles before,
Right.
they'll reintroduce themselves to you.
Right, and in the water sometimes we find muscles that we haven't been working, so they suddenly are more apparent. And
Yeah,
we think,
it's like-
oh, I needed that.
Very
So,
good.
Yes, and there is buoyant equipment that can add to your resistance, and a lot of neat classes that they offer in the Wellness Center as well.
So when you, that's a good point when we talk about the different equipment people can use to
Yes.
exercise and to help them stay in shape and for therapy. What kind of tools do you use?
Oh my goodness,
I
many
have a lot,
things.
I know.
Sure, and it's fun to be creative with the different needs of the patient because not all of us are going to tolerate the same thing. So we have pool noodles, they call them, which is the long tube that's buoyant. There's different sizes, so they offer different resistance. We have belts that people will utilize to, and the belts will have us float in different positions, if you will. There's a lot of different upper extremity equipment. We have water fans that are kind of like paddles. There is a glove that's webbed. There's a boxing glove that sort of looks interesting with a lot of blades on it to catch the water in different planes. Kickboards. I mean, just if you're creative to find a way to work what you're intentionally wanting to work, there's usually a way.
To make it a little, add some resistance, so you have
Right.
to work a little harder.
Sure.
But I think that is one of the nice things of both therapy and exercise in the pool is that it's deceptively easier.
Correct. That's a good way to put it. You're right.
Because you are still exercising. You're just,
Right.
in fact, Terry Rose and I talked about that one day, that
Yes.
you're not sweating really as
Yes.
profusely as you would if you were doing that.
It's not as
maybe.
obvious.
Right, because you're in the pool already. You're already wet.
A little cooler and you're wet.
Yeah.
There are times that if a person's really vigorously running, we can run in the water not touching, and you can actually run again. And you will perspire and get a good workout.
Yeah, that's a good thing to
So
know.
that's why drinking a lot of water is important too, especially if we work on exercising in the pool. It can be dehydrating, so I like that you brought that up earlier. And any manual therapy that we do with our patients is just like getting a massage. You need, when we work those tissues, to have plenty of fluids after therapy.
Because that helps move the toxins out too,
Sure.
right? Okay.
I tell people to watch their limitations if the doctor gives them limitations for fluid, but it's important.
So besides the water, do you do other therapies as well? Are you out
Sure.
of the water too?
I do. The nice thing about me being over in this facility, our facility has moved over to Sycamore now, and we have the new location, and it's beautiful. I do stay here with the pools, and when the therapists, some of them still join me and come over and join me actually in the pool or on land, we graduate the patients to the gym facility if it's appropriate and if they're interested. And then we can acquaint them. If they need further acquaintance, they'll have the fitness instructors and the personal
Help 'em
training
right
available as needed
Yeah.
when they join. So
That's great though that it does give them that full transition from being almost immobile when you
Right.
first get them and learning to reuse those muscles again.
absolutely.
It's got to be like a party time when they get to the the
It
wellness.
is. It is exciting for them, and also to have the motivation around them with the variety of classes available and the variety of people that participate at the
Absolutely.
Wellness Center.
Age is not
No.
an issue here. I mean, I know
No.
we have, well, there's a fellow who takes my water aerobics class in the morning that I
Yes.
think is pushing 90.
Awesome.
And, you know, he's there every day exercising. It's amazing.
And because he can.
Right.
Right.
Yeah. And then there's got folks you see, they're in walkers and they're
Yes.
up there doing the exercising. And so
That's pretty neat.
it is, you know,
Yes.
it's that mind over matter maybe. It's that
Yes.
I'm mentally going to tell myself I can do this.
That's
Again,
exactly right.
So the kind of therapies now that you're doing, is that something that, like, I had a bad knee, so I could just call you and say, hey, Jill.
Absolutely.
No, don't they need a referral?
Oh,
though?
right. I see what you mean. They can call our office.
Yeah.
And their doctor, they need to have a prescription from their doctor.
Yeah,
so
because
they
it's
can
not
get
like
referred.
the gym where we can
Right.
just show up and I'm a member, so I
For
must start
physical,
working out.
you're absolutely right.
Okay.
For physical therapy, they'll just need to get a prescription from their doctor.
Okay.
And then we'll get them the first initial eval. And we work, sometimes we'll balance it with land therapy and water,
Okay.
and we complement each other.
Good. We'll talk more about that. We're going to take a quick
Super.
break, and we'll be right back after these messages to learn more. Welcome back to Your Health Matters. My guest today is Jill Cohn. She is a physical therapist assistant here at KRMC, specializing in water. Now, Jill, I thought about this, we kind of talked during the break, that obviously not everybody is as passionate as you are about the water. In fact, there's a lot of people who are afraid of the water.
Good point.
So how do you help them? And can they still work in the pool?
Absolutely, they
Okay.
can.
Okay.
And then we always make sure we try to accommodate their concerns and needs. Obviously, we want them to be comfortable to benefit from the therapy. I would always be in the water with them.
Okay, so it's not like
And
you just send them out to the deep
Certainly.
end of the pool?
Never. Some I do if they're very comfortable, but most of the time I'm right there with them. I never leave their side. So
Okay. And you have flotation
we
for
do.
them?
We have support equipment, or I support them.
Okay.
So that works. And the smaller therapy pool is 3 to 4 feet in
So that's very
depth.
shallow.
So I tell them if they lose their balance, I'm right there. And if they are comfortable floating, yet they have some apprehension suddenly, they can just stand up. So
That is nice, yeah.
sure, I'm right there.
Okay.
I
So-
appreciate you asking.
Well, and it just dawned on me too, like we said, that not everybody likes the water like
That's
we do.
right.
So, one of the things we talked about too is aqua stretching. You mentioned that. Well, what is that,
Yes.
and how does that work?
Aqua stretch is a really neat technique that it affects and can decrease fascial restrictions. The fascia is connective tissue in between all the
Okay, I
different
was going to ask you,
layers.
what does that mean?
Yes, that's a
Good,
different
good,
word.
Yeah.
And fascia is the connective tissue. I tell people in an analogy if they cook. If you have a chicken breast and you peel that skin off because you don't want that extra skin,
Right.
it's that clear connective tissue that you do see when you pull it off. Well, our bodies are connected with that from head to toe.
Okay.
And sometimes you're reaching for something with your left hand, you feel a tug down on your right hip.
Oh.
That's usually can be connective tissue related. So we have a technique of aqua stretch. I modify it to the comfort of the patient and the
Okay.
person receiving the treatment. And it's really a nice way to decrease restrictions in the tissue and pain.
So does that kind of hold you back? Is that what it is?
Sometimes that causes a lot of the pain, and it can inhibit circulation. It can inhibit motion. So you're
Okay.
right. It does hold
So,
you back.
so when you're saying aqua stretching, you're actually stretching that fascia?
I appreciate you asking how I apply the technique. I will anchor tissues. I'll hold a foot or I'll hold a part of the body that's tender and that hurts while the person's moving in the water. Many people that are comfortable floating in the water, you have this sudden ability, no, it's not sudden, but just as the water, that supports you so you're able to move so freely. We can't do that on land. There's
Right,
the
yeah.
gravity changes how we feel about that. But they can move freely. Well, I can work on pinpoint those spots that are trouble areas. And they don't have to float. They can be standing or sitting. I have other ways to modify it.
Is it
But
like
I
on a
apply the
kickboard or something?
Sure, or,
Yeah.
or the noodles we talked
Yeah.
about. And as I apply the pressure to the tissues that are affected, and they're moving with their own range of motion and their own movement, my movement's different than yours.
Right.
So they'll benefit from that. And it just
Interesting.
tends to take those kinks and those restrictions out of the tissue.
So is it
It's
almost like a
amazing.
deep tissue massage?
It's similar. It can be deep, it can be
Yeah.
light, it depends on the tolerance.
Okay.
And it's one of our manual techniques that we just love to apply.
Interesting.
Sure.
I'll have to come and see you for that.
I think you're right. I think you're right. We'll make a date.
So we talked before the break about that if someone is having some issues, that
Yes.
they can go to their primary care physician.
That's
That's
right.
usually where it comes from, or their orthopedic.
Orthopedic doctors.
Okay.
I'll have rheumatologists refer
Oh.
patients. I have pain management that refers a
Oh,
lot of
okay.
patients,
Okay.
orthopedics.
Yeah.
Any of their doctors, if the doctor and they feel it's appropriate, they can just send them to
that's
therapy.
awesome. So they'll need a script, though, for their
Prescription.
insurance to cover it,
Yes.
obviously. But I hadn't even thought, and that's a good point you just brought up, too, is pain management.
Yes.
So I know there's a lot of people who suffer from chronic pain.
That's for sure.
And so those are the type of patients they'll send to you that sometimes
Yes.
on the land just doesn't work.
You nailed it right on the head.
Okay.
That's exactly right. The aquatics is a great bridge, and it complements land therapy. It's important for us to maintain that land therapy because we're not fish. We do not live in the water.
Don't have gills.
Yes, we shouldn't. And so it's important to maintain that land therapy, but still incorporate the aquatic therapy to help get them tolerant of getting back to their functional, their prior level of function before they had their trouble and pain.
Yeah.
So
Well, and again, I would think because of the water buoyancy that it helps alleviate some of that pain for them, right?
It sure does.
Yeah. And then when you're doing that deep tissue kind of, that's
Technique.
dealing with their pain issues or spots.
Near the source.
Yeah.
Yes.
Yeah.
And we don't stop there. So then once we can drop some of the discomfort and address the main problems, then we work on the conditioning and toning to
Okay.
keep people in a better place where our bodies were designed, whether it's postural or
Because a lot of times it's not one of those things where like you go to bed one day and you're feeling great and normal and everything else, and then you wake up the next morning and although I've had that where I've slept
that
wrong.
happens. Not typically. You're
But
right.
normally, so it's kind of an insidious process, and you don't realize probably that you're not either working as hard as you used to, exercising as hard maybe because things are sore, and then all of a sudden you've gotten fat and flabby.
But we do get deconditioned.
Right,
We really
yeah.
do, and our bodies change, and we can change that tissue. And we just have to find the right avenue.
Okay, and that's
So-
what's good to know, that there's so many different options for
Yes.
people to help. And I liked what you're talking about too, how you can help them transition even further
Yes.
from the pool to land, get them over here into the wellness center,
Yes,
start
to maintain
exercising. That's huge.
it.
And
It is
then,
huge.
And then our pool, as we talked about, it's an amazing gift that we have here for our community, but they have classes going on there all the time.
Yes, they have
Depending on your
more
schedule.
now. We have more since
Yeah.
there's been some expansion. I know that it's an important, therapy can be such a great part of getting a person back to motion and activity. That activity will help them condition, but it also helps other parts of their body, whether it's us stimulating the hormones that we need to maintain other balances in our bodies,
Oh.
other glands to get that balance back. So it gets really deeper than that. So it's a nice complement with all the other disciplines, the different doctors, and
That's good to know too. And I'm not sure that I knew that part. What you're just saying about hormones.
absolutely.
How does that work?
When we're active, we can start naturally stimulating the glands in our body to produce the hormones that we sometimes become off balance with. And we
Okay.
aren't realizing other parts of our body are affected. Sometimes there are limitations, our bodies aren't functioning as efficiently.
Right.
Maybe we can stimulate with tolerance with activity, start
Okay.
getting that part of the health
Yeah.
back. So
Well, and I think again another important thing I keep saying, and going back to what you're saying, but if someone's watching this and they're like, well, I'm 75 years old and I'm overweight and I can possibly do those exercises she's talking about. But what I think is great is what you're saying is you adjust to the person
Yes.
what they're capable of doing and you build them up.
absolutely.
So just because you can't do it now doesn't mean you can't do it someday.
That's right.
Right?
We'd love to give it a shot because many times we can get people to tolerate something, and the therapists on land, they adjust the treatment accordingly as well.
Yeah, and I think that people need to realize that if they've had an
Right.
issue, an injury, something like that, that's hampered them recovering, maybe they
Yes.
just kind of went, well, that's as good as it's going to get. And I think they need to know there's some other options if they haven't tried water therapy.
You're right. I have heard that before.
Have
and I'm
you?
sure the doctors have heard it before.
Yeah.
And you're right.
Okay.
So I appreciate you bringing that to light because many people don't realize they have an opportunity that they might be able to tolerate, and it might get them back to something they thought they'd never do again.
Right.
So
Well, and our pool
They're
is
worth it.
open long hours too. I mean, they open like at 5 a.m. I
They
think
do.
during the week. So
yes.
personally, I'm not into swimming at 5, but 7's not so bad.
Yes.
Anyway, Jill, thank you so much for being on the show
My
today.
pleasure, Jamie.
I always enjoyed talking with you and learning
Yes.
more. And I hope
Yes.
you learned something new. And stay tuned for us next week because I'll have another exciting guest then.